This is your large intestine, casually called your colon. This particular organ is about the most important organ we have in our body. Liver is incredibly important as well. Why is the colon so important? It's because it's the way out of garbage. Just like the plumbing of your house, it's the way that toxins can leave the body. When there's a buildup of toxins, disease ensues. Also, the colon is a breathing organ. In other words, it reabsorbs 80% of the fluid that resides in there back into the body. So what does this mean for us? It means you are either a cesspool in your body or you're a clear spring, depending on a couple things that's happening in your colon. Your digestive process, how fast or how slow is your food moving through the intestines, which is longer than you think, a couple football fields. So depending on what kind of food you're eating, it's either really sluggish digestion, hanging out 99 degrees putrefying, or if it's pretty digestible food, it's moving at a fairly good pace, not too fast so you can absorb your nutrients, not so slow that it's fermenting in the intestines, and then you're getting bad bugs that are growing in that kind of environment. So we want a healthy transit time. We want healthy bugs in there. We want a pretty healthy intestinal wall so whatever's residing in there doesn't get into the rest of the body. Only the good stuff that the colon is sending back out into the tissues. And there are irritable bowel diseases such as Crohn's, ulcerative colitis, diverticulosis, irritable bowel syndrome. These all result from a combination of, there can be some genetic predispositions, but a large part of it has to do with lifestyle and diet. One particular irritable bowel disease I want to focus on today is diverticulosis. And this is because it's becoming really common. Over 60% of patients over the age of 60 have diverticulosis. And diverticulosis is the presence of diverticuli, which are pouches in the intestinal wall, most commonly in the lower left, however, more and more occurring throughout the large bowel. And you may or may not have symptoms. As the disease progresses, of course, one will have chronic symptoms of diverticulosis, which namely is trapped gas in the diverticuli, which causes cramping, abdominal pain. Constipation is a very bad situation for a person with diverticulosis because of those pouches. It can get very painful, and it increases the chance that you will have diverticulitis. Diverticulitis is what conventional medicine treats. So I'll just repeat that in a different way. Gastroenterologists do not treat diverticulosis or the presence of diverticuli. They don't have any tools to do that. They treat diverticulitis, which is an emergency room visit that you will be taking because food gets caught in the diverticuli, you get an infection, and you're in a lot of pain, and you're in the hospital for a few days, and then you're at home recuperating on a fluid diet. So it takes a while to recuperate from an episode of diverticulitis, and this can happen several times a year. Very disruptive to one's quality of life, not to mention work schedule, and can get very expensive. And the way they treat diverticulitis is with, guess what? Steroids and antibiotics, because that's basically the two ways that gastroenterologists treat pretty much every irritable bowel disease. Again, they treat the flare-ups or the infections, whether it be Crohn's flares, ulcerative colitis flares. They can try to suppress these flares with chronic use of steroids, which not even conventional doctors want to do that with a patient because that results in terrible withdrawal. However, steroids, immunosuppressants, antibiotics is all a way that that symptoms are treated, and that's in conventional medicine. Naturopathic physicians such as myself, I'm very passionate about the digestive system because I believe this is one area in conventional medicine that's sorely lacking as far as treating the cause. And because naturopathic doctors are well versed in nutrition and supplements, we're very effective with digestive system diseases. And I'm passionate about this because I think it's a sad thing when someone gets part of their colon removed, either because of too many diverticuli or ulcerating tissue from another irritable bowel disease that might have, if treated earlier, the disease, the cause, might have prevented the person from having this really suboptimal quality of life because they're missing part of their gut, part of their intestines. And so diverticulosis, it's very common, most common in the Western world. So when we hear that, we think, oh, it must be related to lifestyle. It very much is. Now, when you go to a gastroenterologist, they're going to say very little about your diet and your lifestyle. In the case of diverticulosis, they will tell you to eat mostly cooked foods. And again, this is focusing on symptoms. Naturopathic doctors, we are treating the cause of the disease. Our hope is to not only manage the diverticulosis, to prevent episodes of diverticulitis or the infection, to prevent flares from Crohn's or ulcerative colitis, but to heal the tissue, to manage the disease, maybe even reverse the disease, to heal the tissue. Depending on how late stage the disease is, there's always hope. And for heaven's sakes, to prevent removal of any part of the intestines. And so we do this through multiple mechanisms. You know, we want to strengthen the colon wall. Well, guess what does that? Fiber, which is the thing that they tell you not to eat. Now, do you want to go out to Whole Foods or Farmer's Market and fill your cart up with a bunch of raw fruits and vegetables and just go at it? No, you need guidance from a naturopathic doctor. It's case by case, individual by individual. Everyone has a different medical history. Some have been on a lifetime of antibiotics. We got a little bit more work to do on the microbiome, balancing the good bacteria with the bad bacteria. Maybe this is the beginning of a phase for someone and we can move a lot faster. What one can tolerate in a form of fiber, the other cannot. And the pace at which we move towards healing is going to be different for every person. A naturopathic physician is trained in doing all of this. In my 90-day regeneration program, I basically hold hands with the patient as we walk through the rebalancing phase of healing the tissue, eliminating toxins, building new tissue, vibrant tissue, sealing up the gut wall, strengthening the colon with fiber and supplements to strengthen and tone it. 100% cooked food diet and not treating the cause of disease is going to result in a lazy, lax colon wall. And we don't want that because that's going to result in a bad end result for that organ system. We want to strengthen the organ system, feed it the right foods, tone it, balance the good bacteria with the bad bacteria. And again, this is a case-by-case basis for each patient, and where we're balancing the bacteria. And some may need stronger herbs to kill the bad guys. Some just may need a good probiotic. And so I encourage you that if you are interested in preventing flare-ups such as the diverticulitis, or if maybe you have Crohn's, want to prevent that, or ulcerative colitis, is don't wait for the emergency. The time to go to a naturopath is before that happens. Now, although we take those too, it just is a little bit more uncomfortable for the patient if you're already hurting and we're trying to heal the gut. You want to come in before all of that, or between episodes, come in and let's get started on the rebalancing process. And my 90-day, it's a perfect time, I think, to set you on your way towards, wow, I am feeling 100% better than I was 90 days ago, and I'm empowered and educated to keep feeling good. That's the best thing about naturopathic medicine. We're just not sick care. We're teaching you how to take care of your body so you're not always doing sick care. That can get very expensive with your copays. And so fill out my form on my website. I'm sure you have some questions about how to get started. You can fill out that form or just contact me directly through my office, and I'll be happy to answer any questions you have about the naturopathic approach and how to get going on this. Thank you for joining me.